Welcome to a special edition of Understandable Insights, Information to Intelligence with Sue Gordon. In this bonus episode, we look at public health policy as national security, how funding decisions, institutional trust, and political retribution can shape real outcomes, especially for children. This conversation was recorded on December 22, 2025, and first appeared in the extended YouTube cut of episode 23. HHS abruptly terminated multiple grants worth millions of dollars to the American Academy of Pediatrics. The AAP had broken with federal policy in August when it recommended that all young children get vaccinated against COVID-19, diverging from the CDC's recommendation. And then it condemned Secretary Kennedy when he fired the CDC's independent panel of vaccine experts in June. HHS spokesman said that the grants were canceled because, quote, they no longer align with the department's mission or priorities. At the same time, a massive new analysis reported widely off of a JAMA Network open paper found COVID-19's mRNA vaccine was associated with a 25% lower risk of all-cause death over years of follow-up in a national French cohort, with no signal of increased long-term mortality. This is exactly the kind of evidence that you'd expect policymakers to build on, not walk away. But we've talked previously about how HHS planned to cut $500 million in mRNA research, which doesn't just slow our science, it erodes the surge capability, our first mover advantage, and preparedness for the next event. And so from a national security perspective, mRNA underinvestment increases vulnerability, weakens our trusted medical institutions, and undermines our readiness. So what concerns do you have here, Sue?
Yeah. I think I'm on the record as saying that I think Robert F. Kennedy Jr. is the most dangerous of all of President Trump's cabinet picks. And for anyone who knows me, you're going to know how profound what I'm about to say is. I actually made a list of all the things I think are wrong with this and the real direct risks of these policies. Number one, children are going to get sick and some will die who otherwise would not. Think about that.
Probably just stop there. That's enough for me.
2, trust in the CDC guidance is being structurally damaged. And there's a saying in the military, I can't remember which one of my friends said it, maybe Joe Votel, that says you can't surge trust in a crisis. We are structurally damaging trust in the CDC, and trust is the system. Number 3, our outbreak response capacity is being hollowed out, period. We didn't see COVID coming, even though we had some things in annual threat assessments that we were vulnerable to a pandemic. We didn't see it coming. And all the things we had invested in allowed us to respond as quickly as we did. We are hollowing out any outbreak response. And specifically that the U.S. is increasing its vulnerability to the next pandemic. Here's the deal. My next reason is economic costs will rise. And it'll be invisible at first, but you're going to see more pediatric hospitalizations and just a ripple effect of when the crisis governs, when sickness governs what you spend, it is always spending more. When the federal government does this, states are going to fragment public health policy. Right? What Florida decides to do with whether you have to be vaccinated is different from Illinois. You're going to just start seeing it fragmented. And the precedent is super dangerous. I hate every bit of it. People would have you believe that this is the first time we've ever questioned science. Questioning science is the nature of science. So of course, we shouldn't just accept that we know everything. And every policy you choose always has some risk of being wrong. That's the nature of any decision you make. But where our investments have left us previously was in a pretty good place where we saw fewer deaths, fewer disease, things that had been killing no longer killed people. Don't talk to me about the overall benefit of the COVID vaccine, especially the ability to produce it so quickly. Sure. There are some health risks associated for some populations with it. But if you go up to 10,000 feet and think about how miraculous the U.S. response to COVID and that benefit globally in terms of reducing the likelihood of death is phenomenal. And we're not going to be able to do that. So the bottom line here of these things trade short-term political signaling for long-term human economic and security costs. This is really not good. Really not good. Did I say really not good? So not good that I came up with not 3, but 7 points I wanted to make.
So not good.
So not good.
Yeah, we talk about the patchwork of 50 different AI state regulations and how that would hinder advancement and innovation in our AI capability. But that's exactly what you're going to have with 50 states, because the states enforce it through the requirements for what you need to go to school and what you need to participate in activities. And so you're going to have a whole patchwork of people, a population, not just kids, but as they age across the United States are vulnerable. And we do have interstate commerce. We do have a national economy and travel.
As you were talking about America and the complexity and beauty of our system that has federal and state and tries to make those things work together with the benefit of each being able to play off one another, the U.S. is going to partner with Denmark to see if their vaccine policy is somehow one that we ought to emulate. And again, questioning is science, so I don't mind asking those questions. But Denmark, as a model for what happens in the United States, Denmark, teeny. Denmark, relatively homogeneous, not people moving back and forth, bringing things back and forth in the same way. They just simply don't have the same health situation, population situation, or health risks that we do. So, yay, if they've got a winning strategy on childhood vaccines, we ought to take advantage of it. But this idea that somehow, because they do it differently, because they do it in a way that's more aligned with the political preferences of this administration, means that we should just adopt it. Man, health is so much bigger. Population studies are so much more important and so much
Yeah.
harder in our environment than something that is relatively small and relatively homogeneous. So I don't like where we're going on this, and we will pay. And not just in the near term if a pandemic occurs. I'm talking about year over year. Every year you're not investing in new research.
Yep.
You have a multiple of that in terms of years that you're not going to have an adequate response.
Thank you for listening to this special edition of Understandable Insights. Our next full episode drops Tuesday, where we'll break down celestial traffic jams, special envoys to Greenland, Trump-class battleships, and more headlines shaping how we think and act as citizens and leaders.
Thanks for joining us. And as always, remember, we're here for you. And most importantly, go forth, do good, and for goodness sake, be kind to one another.
New and glorious morn, fall on your knees. Oh, hear the angel voices. Oh, night divine, the night when Christ was born. Oh, night divine, oh, night